I'm Hannah and I'm studying T-level adult nursing at Preston College. I chose to do a T-level in adult nursing to gain experience in the workplace and to gain skills I can use in the future. And it gave me good experience to talk about in uni interviews to go on to do paramedic science. So I was on the cardiology ward for 3 weeks and I got to work with nurses, doctors, healthcare assistants, physios, and I got to shadow loads of different healthcare professionals to see what they get up to. I chose to do a T-level at Preston College because they were able to give me lots of different placement opportunities, like in the hospital with the NHS on cardiology ward and at Bethany House Care Home and with St John Ambulance as well. And all these different placements have given me different skills. Like in the hospital, I learned how to work part of a team and be more confident when talking to patients. I chose to do a T-level because I like the way the T-level, you're assessed in different ways. So you get to do written exams, practicals, as well as verbal exams. And I chose to do it at Preston College because of when I went to open evenings, the tutors were really friendly. So in my T-level, you get to learn and study lots of different things. So we do biology, chemistry, physics, and healthcare as well, and we look at person-centred care, holistic approaches, and we look at how people develop different health conditions. So when we're in the practical room, we get to do bed making, we take physiological measurements, we practice donning and doffing, washing our hands. We do role play scenarios as well, so we take it in turns being the patients and the nurses to practice. And that's where we get to do our practical exams as well. So after I finish my T-level, I want to go on to university to become a paramedic and study paramedic science. I feel the T-level has prepared me for my next step as it's given me lots of different experiences in different workplaces.
My name's Jane Parkinson. I work for Lancashire Teaching Hospitals. I work at the Life Centre based at Chorley and a tutor for apprenticeships and T-levels. So Lancashire Teaching Hospitals NHS Foundation Trust is one of the biggest trusts in the North West. We were the first in the country to be awarded teaching hospital status, and we provide many specialist services. We deliver award-winning teaching and development programmes, and we are a provider for the Learning and Skills Mentor and the Level 3 Senior Healthcare Support Worker. We've recently took on the T-levels from the colleges locally to the trust. Working with Preston College has been a very smooth process. The beauty of the T-levels is they get to see it in real time, so it's not like Holby City or Casualty that we see on TV and think, yeah, that's what I want to do. When they actually come into the hospital, they see it's totally different to what they've seen on TV or read in a book. We've just had a cohort of 20 and we've got more planned for the future. Feedback from the wards has been really positive. These students have come in, they're very enthusiastic, they're demonstrating care, compassion. They love talking to the patients and getting to know what the nurses do here. They're also getting experience to work with other departments, sort of physio, OT, pharmacy, things like that, that they didn't really realise that there was potential for a career down that pathway. Coming in as a T-level, they can experience that. What I try and do is get a feel of where they want to be, and I will rotate them to different placements so they can get to experience the surgical directorate, the medical directorate, because they all work different even though we're delivering one service to our patients. Hannah has been fantastic. So Hannah got a place on Ward 18, which is cardiology ward at RPH, and they absolutely loved her. They couldn't praise her enough. The feedback was brilliant. She was enthusiastic, very, very keen, inquisitive, asking questions. So as a T-level, there's a limit as to what they can do because they can't do any sort of invasive work or sort of observations, for example, because you need to be competent in that. But Hannah was shadowing the staff nurses and the healthcare assistants, doing observations, vital signs, looking at the News 2 scores, seeing if there was any discrepancies, if any abnormal readings. She got to work alongside with a vast array of staff, from healthcare assistants to housekeeper to sister in charge to consultant. the physios that was on the ward, and so she got a vast array of that. She has got a lot of experience herself because she works part-time in St John's Ambulance. So she's got a natural feel for this vocation. As I said, the ward couldn't sing her praises enough. She was a star pupil.